what is the home protocol? If anyone outside of here tells you about a treatment, okay, any treatment that is going to last for a few weeks of, I don't know, infusions, everything we do here, and then you only have to come once and you never have to take anything else, and then you get rid of cancer, that is not true, okay? Cancer took some time to be visible to you, and it's going to take some time to get it treated. So the home protocol is the reinforcement that we give you so you can keep fighting cancer back home, okay? For me, I think for everyone here, what you're going to be doing back home, it's as important as what you're doing here, okay? 50% of this battle is going to be done here, and the other 50% it's going to be done back home. Normally we give you the treatment in cycles, okay? Cycles of between 3 and 6 months of treatment, depending on the case, which are going to begin 3 weeks after your last vaccine, okay? 3 weeks, it's the magical number, because this it's a restriction for some other things too. I'm going to explain that later. The home treatment is going to contain allopathic medicines, okay, with off-label uses, which are going to be either not for the recommended use or at a lower dose than usual. Vitamins and also liposomals. Liposomals are liquids, which means you have to find some space on your check-in baggage to get it back home. It cannot be taken on your carry-on. All right? Normally we give you somewhere between 13 and 17 products, and the main goal of this, like I told you, is to reinforce what we do here to maximize the anti-tumor activity. Okay? Now, the main reason why we do everything we do here, it's good tolerance, which means we want you to feel as good as possible when you're trying to get better, okay? I know cancer is not a feel-good disease, right? And this is not a feel-good treatment. Sometimes we have to fight with everything you did before coming here, like chemotherapy and radiation, but we don't want to add any more burden to that issues that you're dealing with. So good tolerance is the main purpose of the home protocol, okay? Any questions so far? No? Now, if you have a high intuition or if you like to be observant, you may see that a lot of your companions here, of the other patients, are taking similar treatments than you, right? You can see each other on the hyperthermia. You see each other here getting vitamin C infusions. You're gonna get vaccines at the end of your protocol, right? So the question that you may ask yourself, why are we getting the same treatment if we have different diagnoses, we have different ages, right? We have different genders. So the main target of the treatment here is the metabolic pathways of cancer. So cancer cells share traits. That's something called the hallmarks of cancer, okay? So that's what we're targeting here, and that's also something we're gonna be targeting back home with the home protocol, which means we can give you a treatment which is gonna be similar in some areas, but it's gonna be effective for your diagnosis. In the end, the effectivity of the treatment, it's gonna be in regards to how much energy we have left, right? And how strong the cancer is. But if we give you a targeted therapy against multiple areas of the disease, we have a high chance of success, okay? Something that I want to come with this particular slide right here is that we can also be flexible with the treatment, okay? Some of you may not be ideal candidates for most of the treatments we do here. Some of you may not be able to do the EVO treatment. Some of you may not be able to do the vitamin C, but it doesn't mean that the treatment is going to be any less effective. If we make changes to your protocol, we're doing it because it's going to be the most beneficial thing for you. Okay? Any questions so far? No? So why do we have to wait for 3 weeks after the last vaccine? Very important. This restriction only applies to supplements mainly. Alright? If you are taking a medication that you're required to keep functioning, you have to keep taking it. For example, we cannot take you off pain medications for 3 weeks. We cannot take you off heart medicines, thyroid medicines, or any medication that you need to keep living for 3 weeks. So the reason for waiting for 3 weeks is that we're going to give you a vaccine made by your own immune system. Okay? That is a very strong part of the treatment. That immunotherapy has made changes in everything we're doing so far. Okay? So in order to make this immunotherapy, we're going to isolate, we're going to collect a blood sample. And from that blood sample, we're going to isolate 3 populations of your blood. The first population is the dendritic cells and the killer cells, okay? Part of your immune system. The other population is going to be the plasma in which the circulating tumor cells are living, okay? And the third part is the red blood cells, which we do not use for your vaccines. So what we're going to do with the vaccines, we're going to isolate the circulating tumor cells and the dendritics. And we're going to expose them, we're going to get them together on the same culture ground, okay? So they get exposed together. Once we have them together, we're going to put inflammatory substances in there. So the dendritic cells get a signal of alarm, okay? They get to know that there's something going on in that area. So they get the picture of the enemy that is nearby. This picture is called an antigen, okay? So dendritic cells do not fight. Dendritic cells present the picture of the enemy to the T cells. So once we have dendritic cells that have the antigen on the surface, we're going to multiply them and inject them back in your body in the form of something we call a dendritic cell vaccine. Once inside your body, dendritic cells are going to present the picture of the enemy to the T cells, the B cells, the natural killer cells that are going to give you and something we call the LAK. And then these T cells, B cells, natural killer cells are going to end up fighting and destroying the cancer. So this process right here, presenting the antigen, the picture of the enemy, passing the baton, this is a very sensitive process. And that's the main reason why we have to wait for supplements for those 3 weeks. Okay, so to let the dendritic cells present the baton to the rest of your immune system. All right? Do you have any questions so far? No?
So we get the dendritic at the end here,
Yes.
but wait 3 weeks and it's still working.
Yes.
And then the supplements.
And then the
kick in.
supplements. Yes.
How long did the dendritic cells last in your body?
Normally the dendritic cells live for about 2 or 3 weeks. The dendritic cells have a very short lifespan. But they start a cascade of the immune activity.
Okay, so the activity continues even
Yes.
after the.
Yes. They already passed the signal.
Okay,
They
so
already
those
passed the baton.
LAKs and the T cells, they keep
Yes, they
fighting.
keep fighting. They
Okay.
keep fighting. Normally, we expect the effect to be effective for 3 to 6 months from the
From
starting
treatment.
of the vaccine.
Okay.
There are new protocols that we're working on in which we're going to give a more frequent vaccine to
Okay.
keep a strong activation of the immune system every month. We're still working on perfecting that process, but that's something that we're working on already.
Okay.
Okay? Yes.
When it says dendritic cells present, what exactly, they present the antigen to the T cells? What does
Yes.
the present look like? I mean, it's just a molecular
Yes.
process that it takes that long kind of to get to the T cells?
No, it starts from the moment we apply the vaccines, but it
Okay.
finishes after that process. It's not like gonna take 3 weeks in total to
Okay.
get started.
It starts right away.
Yes.
But what does it number 5 and why is it number 5 and not number, you know what I mean? Like, what does present mean?
Imagine this, the dendritic cells take pictures,
Mm-hmm.
okay? So we expose them to the cancer cells so they take a picture of it.
Mm-hmm.
We multiply them, we inject them back to you,
Mm-hmm.
and then they have to present that picture
Present
to the T cells.
the difference, how it's different,
I'm sorry?
how it's different.
They already have the picture,
Yeah,
they have it for themselves, and they give it to someone else.
yeah.
Okay, that's presenting the
Something
antigen.
like that, okay,
Yes. They do it to different mediators, which are called cytokines.
okay,
So that's the way they present the antigen to the T cells.
okay.
Okay?
Because it's different though.
I'm sorry?
Otherwise, there would be, it's already there.
The cell is there, but it's
The
taught.
cancer cell is there?
Yeah,
Yes, the cancer cells are already inside of your body, but your body is producing suppressive cells to hide from your immune system. So that's why we have to take the cells out and expose them to the circulating tumor cells and put the inflammatory substances. Okay?
Yeah.
That is something called, let me see, it's gonna be right here, avoiding immune destruction. That's one of the characteristics of the cancer
okay,
that disguises it from your immune system.
Yeah.
Okay? Now, I separated the protocol into the pharmaceuticals and the supplements that we use here. Okay? In order to make it easier to understand. First, we're gonna use back home anti-inflammatories. Okay? Cancer produces its own inflammatory environment. Alright? That is something called sustaining proliferative signaling. It produces its own food. Okay? So we give you anti-inflammatories in order to decrease the inflammation that the cancer is producing that is helping the cancer growth and spread. The main drug we use back home is called dexamethasone. Okay? Dexamethasone is a corticosteroid normally reserved for serious situations of the body. If a patient is in the ICU, he's getting high doses of dexamethasone. If a patient has brain swelling, he's getting dexamethasone back in the hospital. If a patient has intractable nausea, we give high doses of dexamethasone to get rid of that nausea. Okay? But the main target of dexamethasone in our protocol is targeting something called nuclear factor kappa beta. Nuclear factor kappa beta is one of the main inflammatory pathways that the cancer uses in order to produce an inflammatory environment and grow. Celebrex is another medication that we give to you specifically to target something called COX-2. And by targeting COX-2, Celebrex also inhibits a factor called VEGF, vascular endothelial growth factor. And what does it do for the cancer? It helps the cancer produce blood vessels. Okay? It basically helps the cancer produce blood vessels, which are going to be like highways for the cancer to spread somewhere else. Okay? So that's the main purpose of the Celebrex. Next, we have metformin. Okay? Metformin has been used for close to 70 years now to treat diabetes, type 2 diabetes. We are not using metformin to target your blood sugar levels. Okay, most of you may think about that because, well, that's given for diabetes. We're not using it for diabetes. The main target of metformin, it's inhibiting something called mTOR1. Okay, mTOR1. It's one of the main pathways that cancer uses in order to become resistant to cell death. Okay? That's one of the main pathways that cancer uses to become something pseudo-immortal. Okay? So by targeting mTOR1, we can make the cancer cells mortal again, and we can be more effective in killing the cancer cells, especially on cancer stem cells. Cancer stem cells are the main responsibles of cancer becoming resistant or spreading or coming back after supposedly being defeated. So that's why we target the mTOR1. There are some recent research looking into the effects of metformin on preventing cancer. Okay, that's still a work in progress. I've been taking metformin for the last few months in order to prevent it. There's also some longevity effects of metformin. Okay, so it's becoming a very interesting concept right now. Now about the metronomic chemotherapy. Okay, metronomic chemotherapy is one of the most controversial ones here because if you see this, you only focus on the word chemotherapy, right? You forget about the word metronomic that is before that. And I understand it. First, I want to make clear that we're not against chemotherapy here. Okay? Chemotherapy can be effective in some diagnoses at certain times. For example, testicular cancers are very sensitive to chemotherapy. Okay? Some blood-borne cancers, leukemia, in an aggressive state, it's very effective. It's very sensitive to chemotherapy. You have 80 to 90% range of success with chemotherapy in those cases. But for most other cases, chemotherapy shows severe side effects with very minimum improvement. Okay? And most of the times, it's a losing battle between chemotherapy and cancer. You have to choose which do you want to kill you, right? So what we do here, it's a low dose chemotherapy protocol that we call metronomic chemotherapy. Instead of giving you high doses of conventional chemotherapy every 3 weeks, we give you a low dose with a very specific schedule in order to avoid any possible side effects. Okay? The first one we use, it's called cyclophosphamide. Okay? Cyclophosphamide, it's not gonna serve a chemotherapy effect in your body. Cyclophosphamide, it's not gonna kill cancer in your body. Okay? You can ask Dr. Google or more recently Dr. ChatGPT about low doses of cyclophosphamide as immune modulator. That's the main purpose of cyclophosphamide in our protocol. Improve the activity of the vaccines that we're going to give you. By how? By decreasing or inhibiting the activity of something called T regulator cells, Tregs. Okay? Tregs are one of the main bodyguards of cancer inside of your body. That's why your body is not reacting to the cancer. That's why your body is not fighting against it, because cancer is producing an immune suppressive state on your body. Okay, and that's the main purpose of the cyclophosphamide, to inhibit that. Alright? We're giving you doses which are between 10 to 20 times less than the effective dose of cyclophosphamide. So it's neither going to cause the chemotherapy effects or the expected side effects from cyclophosphamide. Some patients may develop some slight anemia or a decrease on the white blood cells, but it's nothing severe in regards to this drug. Okay? The other one, capecitabine. Capecitabine is gonna be serving a chemotherapy purpose in your body. Okay? Capecitabine, it's a prodrug that converts into something called 5-FU on the presence of a couple enzymes that are rich in your liver and on the cancer tissue, which makes it a more targeted kind of chemotherapy. Okay? Now, capecitabine works together with everything else we do here in order to become more effective. The vitamin C, the ozone therapy, or the EBU also serve a training purpose in your body in order to make it more sensitive to capecitabine. Okay? Now, capecitabine, being a low-dose chemotherapy medication, can cause some side effects, which I want you to be aware of so we can make adjustments based on the way you feel. The main possible side effect is something called the hand-foot syndrome. Okay? A neuropathy of the hands or the feet. Normally, an expected side effect from platinum-based chemotherapies. Some of you, if you have chemotherapy before, especially Folfox or any oxaliplatin or platinum-based chemotherapy, you may have something like that, the hand-foot syndrome. The difference between what happens with capecitabine and what happens with Folfox is that this one can be adjusted. We can adjust the dosage of the medication that we give you, releasing or decreasing the side effects of it. Okay? So if you have any issues regarding your hands or feet, I want you to report it back to us so we can make adjustments on this drug. Okay? If you already had issues with it before, it doesn't necessarily mean that they're gonna get worse with this, but it means that you're already sensitive to these side effects. So I want you to be especially observant of this issue if you already had it before. Yes?
Teresa already has neuropathy,
Yes?
so will that make it worse? I mean, the other did, that's what I was wondering.
It's not expected. It's a possibility, so she has to keep, ideally I would like her to keep a diary of how she feels, to see if it worsens, because sometimes it's hard for you to really listen to your body that way. Okay? Normally we see it in about 20% of the patients. So it's a possibility, but it doesn't necessarily going to happen. Okay? This is not a platinum-based chemotherapy like the other one, so it's not necessarily going to happen. Alright? Some patients also report fatigue, nausea, or diarrhea with this one. Okay, so I would like you to be observant. I'll report it back to us in case anything happens. Alright?
Dr. Julio?
Yes?
The tingling, for example, that may occur with capecitabine, will that subside over time, or is that pretty much like a permanent thing that you?
No.
It will
Normally
subside?
it subsides with the rest periods,
Okay,
and once you stop it, it starts
To-
lowering down.
okay.
The
And
thing is, the more you take it, before reporting it, the more it's gonna take to get better.
okay.
Yes.
And then the other question I have is about the statement that says that capecitabine synergizes with oxidative therapies such
Yes.
as ozone and high-dose vitamin C. So does that mean capecitabine is best used in conjunction with those therapies, or
Not exactly.
okay?
What we do here normally is straining your body. The effects of what we do here, of ozone therapy and vitamin C, last for a long time.
Okay.
So it doesn't really mean that you have to keep taking
Keep
that or
doing
doing that back home in order to be effective.
Okay.
Okay? Any other questions so far?
I experienced the tingling like in my hands and feet when I was taking the chemotherapy, similar to what you're talking about. But one thing they did is had me hold ice packs in my hand. Would that be?
It's not the same.
Okay.
Because when you're doing, they normally give it when you're doing the chemotherapy, and this is pills that you take twice a day. So it's gonna be,
Yeah,
the absorption is longer,
true.
so it's not like you have to be taking ice packs all day. Right? But yeah, that's the thing they do to prevent it with chemotherapy. Now, about the supplements that we use here, okay? And the liposomals that we do here, starting with the baking soda. First, I have to dispel the theory that is going around some areas that says that you have to make your body alkaline, okay? Alkaline diets, alkaline food. It's impossible to make your body alkaline, okay? It's not safe to make your body alkaline. God made you perfect. You have a very specific range of pH in your body between 7.35 to 7.45, and that's it. Anything higher than that, it's bad. Anything lower than that, it's also bad. Okay? The main purpose of the sodium bicarbonate is that it's the main buffer of the body. It's the main thing that God gave you to keep the body stable. Okay? And something that the cancer does, something we already knew before, right? Cancer eats sugar, right? Something that most people know. But cancer also releases lactic acid as a byproduct of this sugar consumption, which means the tumor microenvironment of the cancer is very acidic. Okay? So we give you sodium bicarbonate in the form of baking soda because sodium bicarbonate It's one of the few elements that can modify that pH, that is very acidic, improve it so the immune system can be more effective against it. Okay, that's the main purpose of the baking soda. Alright? Next, we have fibrenza. Fibrenza is a systemic proteolytic enzyme. Okay? What does it do? It breaks protein walls. And when you have a cancer, you have something called the extracellular matrix. A tissue surrounding the actual tumor that is very stiff. Okay? And this stiffness gives protection to the cancer. It gives support to the cancer. It communicates with the main tumor to keep it active. So by weakening this matrix, we can make the rest of the therapies more effective. Okay? That's the main purpose of the fibrenza. It also has an anti-inflammatory effect. And this one has to be bought online. We don't have access to it in Mexico. You can get it in the US, okay, but you have to buy it online. I found it on Amazon. Most patients get it from there. Some patients go straight up to the main supplier page. But any way you can get it, it's effective. Okay? The other one we have is the AHCC. Okay? We mainly recommend this specific brand, which has an immune modulating effect. It improves the activity of the immune system against pathogens, but also against tumors. Okay? So that's the reason we'll give you this specific one. This one also has to be bought online. Okay? Any questions so far? No? So, if you were to be here 5 or 6 years ago, we used to have a protocol like this in all of your rooms. Okay? Some patients have told me that they used to take somewhere between 60 to 70 pills a day. Besides everything else we're doing it here. Okay? Actually, early last year we used to give you a pill box. We're not giving you a pill box anymore because most of the treatment we give you are now in liposomal form. Okay? Liposomals, specifically the ones we use here, are nanometric capsules of supplements contained within a layer of fat and water. Okay? So what does it mean? We give you a very small particle of supplement, way smaller than a red blood cell, okay? Which means the absorption rate of the liposomals is closer to the absorption range of the IV. But it's something that you take orally. I know the taste is not the best, okay? Half of the liposomal is olive oil. So that's a losing battle from the beginning. Some of them have fish oil too. So that also adds to the taste. But the absorption rate of this, it's worth it. Okay? Any questions so far? No? Now we're going to start with the melatonin. Okay? Melatonin, it's not prescribed as a sleeping aid. Melatonin is not given to you to help you sleep. Melatonin is a hormone, a very complex hormone with effects on multiple areas of cancer. Remember the image I showed you before, the picture with the circle on it? Melatonin basically affects all the aspects that I showed you before. Okay? So that's the main purpose of it. Now, yes?
How much melatonin, do you give a patient?
We give you 30 milligrams. Okay?
And that's over a month or a day?
That's every day.
Oh, every day.
30 milligrams every day.
Okay.
Normally the dosage for sleeping is 3 milligrams to 5 milligrams. We give you 30. Okay? I've seen patients take higher doses. I have seen patients take 270, 180. There's several articles that say somewhere between 0.5 to 1 milligram per kilogram it's effective. So 30 is a good effective dosage. Okay? The main issue we see with this one is that melatonin extends the REM cycle, the time frame in which you have actual dreams, which means some of you may have lucid dreams, some of you may have nightmares, some of you may have weird dreams, some of you may be awake instead of getting to sleep with this one. Okay, so that's something we get to see. Sometimes we make adjustments to the frequency of it, sometimes we take it earlier than usual in order to decrease the side effect, but that's something that we normally get to see sometimes. Alright? Now, BASNA. BASNA is the yellow liposomal we give you twice a day, every day. It has something called silymarin, okay? Something that's normally known as milk thistle. Milk thistle, it's a liver protector. It helps you process everything else we're giving you, okay? It also has curcumin, which has anti-inflammatory effect.